back, you talked about a few of the popular mythologies about Cuba, and one of which I want to go back to is this idea that Cuban healthcare, universal healthcare, is a model for the world. And you had some pretty compelling data. It's hard to find data in Cuba, as you point out, but you had some pretty compelling data demonstrating the impossibility that it's true. Talk a little bit about that.
Yeah, well, it's a huge topic. And the problem with this is that unfortunately, the Pan American Health Organization and the World Health Organization has spent decades lending their credibility to Cuba's false statistics. So when you have a authoritarian, in the case of Cuba, it's a totalitarian system that controls education of the scientists and doctors and health professionals, where they control all the institutions. The whole healthcare system is under state control, where they control the manufacturing of medical supplies, drugs, etc., and where they are not just the one that commercialize them overseas, but also regulates them. They control everything. So then you have the World Health and Pan American organizations saying, oh yeah, this documentation that they provide us, these statistics are true. And Cuba supposedly is one of the leaders in the world on infant mortality, on all sorts of data, on communicable diseases, and you name it, they're there. And when you talk to Cuban health professionals who have been in the system, or statisticians or economists, there's thousands that have left that are overseas. They tell you how this is controlled. And it's a scandal that, we have in the world this idea of a medical power built on those lies. I'm not saying that every statistic coming from Cuba is incorrect. We can't prove that. But most of them are in question, and some of them can be proven completely false. I just wrote a major work on the role of the Organization of Pan American Health, PAHO, Pan American Health Organization. I get them sometimes mixed up in Spanish and English. In English, it's PAHO, and I give some examples on Cuba's statements controlling dengue fever, cholera, that have been proven wrong by studies outside of Cuba, and yet you don't see this. It's really scandalous, but yet you have organizations around the world, including one in Oakland, California called MEDIC, Medical Education Cooperation with Cuba. It's MEDIC with 2Cs.org, that has millions of dollars in budget, a full-time staff, a medical journal, access that we don't have, just dedicated to propagating this idea that Cuba is a medical power.
Yeah.
And how do you compete with that? They have taken, there's a report by the Atlantic Philanthropies that gave MEDIC $17 million in funding in the course of, less than 10 years, that took more than 600 trips of, staffers from Congress, medical associations in Havana, to the Potemkin tour that they subject them to. And then these people come back and they in turn propagate this idea.